information.
Well, I mean, dating to me is more so about getting to know people, like, and
well,
then
I mean,
you
I
choose
asked
to
you
be in a
earlier.
relationship.
I asked you earlier. You said you've been single for 2 years.
Mm-hmm.
I asked if you were celibate, and you said, "Yeah, I've been celibate for 2 years." So, I mean, I know you don't want to talk about it,
Well,
but
when you were saying,
implied
like, these 2 years, if I was
you're not a
celibate, I was
virgin.
saying yes.
It's okay. We're all adults here. This
Right.
is a fairly, I mean, the average age of the panel here is in their 30s. Sex is it's not a super taboo thing to talk about.
Right.
We don't need to talk like details about
Right.
any sexual experiences, but I don't think at 30 years old it's would be wrong for you to say you're not a virgin.
That's okay. I respect your opinion. Like, I just don't feel that way about
Well, I
myself
don't think it's
right
opinion.
now.
I think it's just factually
That's okay.
true. Like the current social mores and climate, I don't think it's objectionable to
Yeah.
at 30
That's
and
okay.
amongst a panel of your peers who are similarly aged to
Right.
simply say whether you're a virgin or not. In any case, you already basically implied that you weren't, so.
Okay.
Okay. This is going to be a difficult
Would it be better if he...
Actually, I'm sorry, Q. I didn't mean to cut you off.
I just wanted to know really quickly, would it be better if he would have asked you, based on the information you provided, do you think it's unreasonable based on your dating history and this new journey that you're on, that a man would accept that? Do you think
Accept what? I'm sorry.
like your current terms in which you would want to date?
I can't say for sure. Like, I don't know. Like,
You don't have an opinion either way on if that would...
It's not about that. It's more so about, like, I'm okay being alone. Like, I'm okay. So to me, even if I choose to be married and have a husband or not, that's okay. Like, it's the right person will be okay with that. Will respect my boundaries. Will respect what I need to make me feel safe, and that's okay.
So you're okay with... So you don't want to be married. You want to be married, but you're okay being alone?
Well, I would like to be married, but I also can accept that if I'm not compatible with someone in that regard, that's okay. I'm not going to force and be too attached to the outcome, but I am putting in effort. So that's what I'm trying to explain.
Okay. All right. You got the floor is yours, Andrew.
Oh, thanks, man. Well, I was just curious. You got a dating coach for the express purpose, I assume, of learning dating techniques or understanding better about how the dating market works, right?
Yeah, and relationships in general as well. Yeah.
If a big part of relationships is going to be the history of the person, you would agree with that, right? Mm-hmm. Yeah. So if you're talking about dating specifically, then the history of a person, how they treat other people, how you treat other people, your sexual history, all of that is going to go into the idea of this compatible partner. That's what Q's talking about here, right? The compatible partner. So when Brian's asking this, it's not designed to make you feel bad or horrible or anything like this.
Right.
It's to explore the viewpoint of what it is that you're after in the dating market.
Right.
And if your expectations are reasonable or if they're unreasonable based on what you're bringing to the table.
Right.
Not asking this in order to hurt your feelings or do something like this.
No, I understand. I'm just not comfortable sharing that publicly. Like I said, I'm trying to rehabilitate into a society that I didn't really, as a child growing up being more alone. So it's like it's a little bit different of a different experience for me to just share intimate parts of my history in that way, like intentionally, and so that's why I'm not comfortable with that.
Wait,
I did want to point out. One commenter said something here that's actually pretty clever and pretty funny, that you are indeed wearing rose-colored glasses. I just wanted to point that out.
Right. No, it's because I get migraines, and so for my history, like the rose-colored glasses block like some of the lights, like how bright they are. Yeah, it's for my migraines.
It's just ironic is all. I'm just pointing out it's very ironic. But anyway.
Okay.
Wait, you said that your what was it? You said something like your recovery, or what was it, the word you used? There was a word you used. It was like my recovery or something? Damn.
Rehabilitation.
She said rehabilitation. Rehabilitation.
From what?
No, like trying to rehabilitate like into society. Maybe I'm using the term.
Were you in prison for 10 years? What?
No, that's not what I'm saying. What I'm saying is because I was not very socialized, and so to me, I don't have those. I'm not completely comfortable, so I'm trying to learn how to be more social.
Wait, okay, a couple questions. From what, you were always homeschooled?
I was homeschooled in high school, But before that, like, I did go to elementary school and middle school.
Did you have friends while you were homeschooled?
Yeah. No, when I was homeschooled, not really, because I would go to school like once every 2 weeks to a month, and I would do my homework by myself. Like, I wouldn't be at, like, it was like I taught myself.
Did you go to college?
I went to college, yeah.
4-year or 2-year university?
2-year.
Did you have friends while you were in college?
No, I mean, at the time, like, we knew people, and it was like how do you say, like an acquaintance, more like a classmate, but a friend like that has carried on. It's not really something that has continued on.
And you only did 2 years of college?
I'm currently like in school as well. Like, I switched majors.
You've been in school continuously
Yes.
since you were 18?
Yes. Sure, I changed majors, discovering who I am, taking care of my parents. So it's been a lot, like being in therapy as well to help me, like kind of.
How long have you been discovering who you are?
For sure, a lot more heavily in therapy the past like year and a half.
What are you in therapy for?
A lot of the grief that comes with my day-to-day with my father. He's currently on
Sure.
hospice, and
That's
just the
difficult,
changes, and just with myself and things that I have.
Were you in? How long have you been in
develop.
therapy for?
So therapy for me, it's been almost 2 years, a year and a half.
How long has he been in hospice for?
My he's on hospice since the beginning of the year.
Okay. But you said you were in therapy to deal with him being in hospice.
Mm-hmm.
Certainly that's a very difficult thing. But you were in therapy prior to him entering hospice. So what was the primary reason for going to therapy?
So I have like a lot of grief in regards to my dad, my attachment to my dad, and trying to understand like just like the reality of life, and like what I thought, like always being inside my parents' house is a different perspective and feeling versus being out in the world.
Have you ever lived alone?
No.
Out of the house?
No. Well, I don't live with my parents, but in that instance, yeah, like renting a room. Yeah, like renting.
Oh, you don't. So you don't live with your parents?
No.
Have you ever had housemates or?
Yeah, that's what I was trying to say, like a roommate. Yeah.
Since.
And that was hard for me in the beginning. Like,
Do you live alone now?
No, I'm renting a room.
Okay, and you've been in and out of college since they pretty much 18?
Yeah.
Okay, and you've had jobs too?
No, just working for my parents.
Oh,
I
never
get paid
had-
to take care of my
Okay,
parents.
you've never had like even a short-term thing?
No. My parents it's a full-time thing, taking care of my dad as
Okay.
his disease has progressed. And now there's another caregiver for him who works full-time, 40 hours a week for him on top of what I do.
So wait, can do you mind if we back up just a little bit? So I'm kind of taking notes here. You have never had a job? Is that what you said?
No, just taking care of my parents. There
Okay,
was one
gotcha.
time that I was able to like work for the Veterans Hospital like for like a month, and that was it. But other than that, no.
So you've lived at home with your parents for your whole life?
No, I don't live with my parents.
Okay. When did that change?
Probably around 19 years old.
19. Okay.
Yeah.
So how have you been affording to live on your own?
I get paid to take care of my parents by the state.
By the state?
Yeah.
Right?
Yeah.
Okay, gotcha.
Yeah.
So you do have a job.
Yeah,
The
but
state
I'm saying
pays
it's
you
them.
in a hang on. I just want to
Oh,
make sure I got this
sorry.
right. The state pays you in a caretaker position
Yes.
for your parents, right?
Exactly, correct.
Okay, gotcha.
Yes.
Gotcha. Okay. So, and they've been paying you since you were 19 years old to do this?
Yes, since 18.
Okay. Oh, since 18. Okay, gotcha. All right. I wanted to just kind of get that clarified real
Thank
quick because
you.
I didn't understand how you lived
No, it's okay.
without a job. So
Right,
the state allowed you to be a caretaker and has
Yes.
paid you since you were 18 years old to
Yeah.
take care of your folks, right?
Yeah, they have social workers that come out and evaluate everything, and doctors and everything. Yeah.
Now, my understanding in these situations is that you can opt out and the state will still provide a caretaker.
Yeah. Yeah.
So then this was a choice for you to stay on as the caretaker.
Right, and that's where with therapy I'm learning that, and my autonomy and my empowerment to make my own decisions and break away from this. I think that I was conditioned into this role, and I didn't really understand that and realize that. And so now, like you're saying, like there could be another caregiver, in which there is, who also works 40 hours a week. And so now I'm kind of on my journey to figure out and create a new life for myself without my parents, like in that sense. Yeah.
On your journey to figure this thing out.
Yeah, on my own, like, and so school, and I'm more definite on my path as far as like my career path. So I'm grateful for that. Yeah.
Okay, so so you chose to stay on as a caretaker. You were paid as a caretaker to take care of your father, and have been even to right now, right? Right,
yeah.
This second.
Yes.
Okay, gotcha. Yes. And you did choose to do that, right?
Yeah, like realizing that it is a choice. At first it was just like, I have to, who else is going to do it? It's my family, it's my father. How do I abandon my family? Like that's where my loyalties would lie. But now understanding with therapy and like having my rights as a person reflected back to me, right, that wasn't reflected like when I was growing up. So it's now I feel a lot more empowered to understand that, look, when I graduate and I'm done, there's going to be another like caregiver. For right now, like I can maintain going to school and my position with my family, with my parents.
Okay, I just wanted to make sure I had that clear as we go
worries.
forward in the conversation.
Yeah. Wait, is this this thought process here, has this been sort of instilled in you by the therapist?
Now, yeah, for her to recognize that like I am an autonomous person and not an extension of my family. So, because I'm very loyal to my family. So,
what's wrong with that?
Well, because a lot of my attachment to like my family is like, what am I going to do when they pass? All I've known is taking care of my parents, and so simultaneously trying to go to school, but with my the paths I was taking were not giving me like that definite courage or empowerment to break off. Yeah, for my own independence. So, thank you.
Yeah, so what you're saying is that you've never had any other job, or you've never done anything except this.
Exactly.
Your dad's going to pass soon because he's in hospice care, and you don't have any idea where your income's going to come from.
Yeah, so I've been preparing for this, but it's different now. Yeah.
Mm-hmm. Gotcha.
Is the therapist free?
No, I have insurance with my job. Yeah.
The insurance pays for it. Okay.
Yeah.
Huh. Interesting. Wait. And you've been doing it since you were 18.
Mm-hmm.
Why?
No, paid for it before I
Are you?
at 18.
And was it a full-time job or full-time?
Well, it started off like as the progression of hours. They started to see his his Parkinson's, his physical. It starts to deteriorate in his mind and stuff. Yeah, so it progressively was increasing in hours to the point now, present time. Recently, within the last 2 years, I was given extra time for him, so I was able to hire extra help. So now I can have days off, which is, I understand, like, now I can have time to myself, see who I am, what I like to do, and take myself out and stuff, even alone.
Okay, all right. Okay.